this is one of the reasons why I love these so much. It's like, so we're talking, I had some things like, okay, that I know I want to talk to you about, but you just brought me onto something else that I don't think there's enough information on. I think you would be well versed on. And I want to get this information out there for women that are looking. Well, first of all, what kind of symptoms does a woman have that may be a little different than a man in terms of low testosterone? And what ages and what kind of things cause that in a woman? Because and some people don't get it, like, and I get it from being in the bodybuilding world, but if a
Right.
man crushes their estrogen, we got a problem. We got a big
Right.
problem, right? And same with the women. I know that estrogen's dominant in women and vice versa, testosterone, but I don't think people truly grasp the concept of you still need some, right?
Exactly. Obviously our proportion of estrogen testosterone is much different than you guys,
Mhm.
but we absolutely need testosterone, and we need it for the exact same things guys do, right? We need it for libido, we need it for
Mm.
orgasm, we need it for muscle building, we need it for fat loss. And it gets so ignored in women. And it's sad. I mean, and for orthopedics. So my background's from orthopedic world, and I put a lot of my orthopedic patients, if they're trying to heal a fracture or trying to heal an injury, and they have no androgens on board, they can't do it. And so it's very funny. I put recently a patient who was having surgery on some anabolics, actually, just to help her heal from surgery. And of course, her doctor came back, was like, "What the hell? What are you doing that for?" So for women, it gets really neglected. The gynecologist may look at progesterone and estrogen in women as they're getting menopausal, but not testosterone. And the problem with testosterone is it starts dropping very young. So
Mhm.
when you look at women, you know, usually progesterone starts dropping at a very young age. Testosterone starts dropping at a young age. Estrogen stays high pretty long, and that's why you get these women who start having that estrogen dominant body. They have that kind of big belly, big breasts, skinny little legs. You
Mhm.
see them all over, right? I was
Mhm.
at a Billy Joel, Stevie Nicks concert, so it was all people my age, right? And all these women had that exact body build, right? They all had like the little round, belly, boobs, and no muscle. And that's just this estrogen dominant state where you have no testosterone and you have no progesterone, so that you have to balance these hormones. And as we age, it becomes even more critical because maintaining muscle is so critical to
Yes.
our overall longevity. I
Yes.
always say muscle is sort of our currency to life, and you have to have muscle to be able to do everything in this world. If you get sick and you don't have muscle mass, you're not going to do nearly as well. If you have an injury, you're not going to do nearly as well. So we have to maintain muscle. Absolutely impossible to maintain muscle if you do not have testosterone, right? So I
Mhm.
see these docs who are telling women to go exercise, and their testosterone levels are, 0.003, for free testosterone. I'm like, you can go exercise all you want, and
Yeah.
you might as well just throw yourself down the stairs because you're going to get real sore, but you're not going to build any muscle. And so it's sad because these women are trying. They're truly going to the gym. They're trying to exercise and they're trying to do everything right, eat right, and they're not losing fat. They're not putting on muscle, and that's because they're working with a detriment of having no testosterone.
Yep.
But let's look at the younger women because that's a group that scares me a lot. Because if you look at what like birth control pills do, and almost 50%, if not more, of women are on birth control pills from a young age. Some even starting at 13.
Mhm.
So when you look at that, and sometimes that may be the best choice to prevent pregnancy. Obviously, an unwanted pregnancy is also a very bad thing, but there are other options. What women do need to realize if they are taking birth control pills is birth control pills raise something called sex hormone binding globulin, which a lot of
Yes.
your listeners are aware of, but a lot of people aren't. And sex hormone binding globulin binds the testosterone, so it's not available to utilize for muscle building and all the things you need it for. And so what you'll see in these women is they have very, very high sex hormone binding globulin levels when they're on birth control pills. So they have no free testosterone, no available testosterone.
Mhm.
So they have trouble building muscle, they have more injuries, they get more depressed, they get more anxious. Remember, testosterone, just like in men, symptoms of low testosterone in men, lots of times that anxiety, depression, that sort of low grade, just feeling beaten down by the world. The same
Mhm.
thing happens in women too, right? It's a little why men are always a little bit, tend to be a little less anxious and a little less depressed than women oftentimes. Is this testosterone is very protective of them until it drops. Well, same thing with us. So we have this very protective hormone that's telling us, you can take on the world, you can, fight against all this stuff. If I have no testosterone, I feel defeated, feel like I can't really do this stuff. It also, just like in men, helps with sleep, right?
Yeah.
Testosterone, if you think about guys fall asleep after sex, it's because this big surge in androgens. Same thing with women. If you have more androgens at night, you're going to sleep better. You're gonna have more, you're gonna have more restful sleep. So we always think about it for muscle building and maybe libido, but think about it for all the brain functions too. Depression, anxiety, sleep
Yeah.
quality. Those are all really important. Well, there's very few women, very few over the age of 40 who will have normal testosterone levels. And I will tell you, because I have a lot of young patients as well, I would say at least half of my young females have low testosterone levels. So if you're on birth control pills, you may need to supplement with some testosterone, right? And again, the dosing on that is so variable. You have to find the right dose, and you have to look at how people are metabolizing it so they don't get side effects from it. But it's so critical, you guys, to well-being. And I get sad when I look at these women in the gym who I see over and over and over again in the gym, and they're there and they're doing things and they're actually lifting weights. Maybe not heavy enough, but they're not. They have no strength because they don't have any androgens, right?
Yeah.
So it's sort of the same symptoms as in men. It's just that in men they're protected a lot longer than we are, right? The testosterone levels, well, I won't say anymore, but used to be testosterone levels didn't start dropping until men got a little bit older. So they were more protected for a longer period of time. In women, they start dropping quite young. I mean, our optimal testosterone levels are usually around 15 to 18, honestly.
Right.